Good morning. So the objectives for this lecture, being able to describe drug classification systems, differentiate among the following drug names. What is a generic name, an official name, a trade name, or a chemical name? Explain what is indicated by a number included in a drug name, like Tylenol number 3. Discuss the purpose of tall man lettering, and explain the restrictions of drug sales implied by the following. So over-the-counter drugs, legend drugs, which are prescription drugs, off-label drug use, and controlled substances. Pharmacology is the study of drugs, their origin, nature, properties, and effect on living organisms. To provide clarity of the drugs that are on the market, the following are resources that assist to know why drugs are given, how they work, and what effects to expect. Numerous drug references geared towards a variety of level of readers, from layperson to pharmacists, and grouping drugs under broader subcategories. So continuity in the use of basic identifying terms for names and actions of drugs. So let's talk about drug classifications. Drugs can be categorized under broad subcategories called classifications. So grouping them together according to their therapeutic use is very helpful. Drugs that affect the body in similar ways are listed in the same classification. So some major drug classifications include therapeutic uses, their most common side effects, precautions to be used, contraindications, indications that may occur while taking the drug with other drugs or foods, and some of the most common product names, their usual doses, and comments on administration. So all of those things are taken into consideration when coming up with a drug classification. Identifying drug names. Drug names can be very complicated as each drug has many names attached to it. When a company produces a new drug, they assign a generic name to it. After testing has been completed by the FDA, the drug company then gives it a trade name, often a shorter, easy to remember name for marketing. From time to time, from the time the drug company submits the application for a new drug to the FDA for approval, the company has exclusive rights to market the drug for 5 years. Once approved, the drug is then listed in the USB or NF by an official name, generally the same as the generic name. Now, a generic name is a common or general name assigned to the drug by the United States Adopted Name Council. It's differentiated by the trade name by an initial lowercase letter. It's never capitalized. So when you see two drugs side by side, the generic name should be always lowercase, and the trade name, which is the marketed name, will be uppercase. An example would be acetaminophen and Tylenol is the same drug. Acetaminophen is the generic name. Tylenol is the marketed brand name. So trade names or brand names. The name by which a pharmaceutical company identifies its product, it's usually copyrighted and used exclusively by that company. It's distinguished from the generic name by the capitalized first letter, often shown on labels and references with the symbol R after the name for a registered trademark. Now, breaking it down a little bit further, and this you don't so much need to know, but the chemical name is the exact molecular formula of the drug. It's usually a very long, difficult name to pronounce, and it's often little concern to healthcare professionals. And then there's the official name, and this is the name of the drug as it appears in the official reference in the United States Pharmacopoeia National Formulary. Generally, it is the generic name. So the official name is the generic name. Those would be lowercase, and the trade name would start with a capital letter and usually have an R after it for a registered trademark. So identifying drug names. So most states enacted legislation encouraging physicians to let pharmacists substitute less expensive generic equivalents for a brand name of drug. So if a doctor prescribes you a brand or trade name of a drug and you go to the pharmacy and the generic name is cheaper, it allows them to then fill it with the generic equivalent. Of course, laws vary from state to state. And sometimes this is the reason why a physician might state no substitutions and may indicate dispense as written. And so why they would do that might be that the physician has a preference for treatment. Patients may be difficult to stabilize on a certain class of medications due to fillers being slightly different, and dyes may alter the effect of some sensitive patients, leading to an allergic response. So sometimes switching out to those generic medications can have just some slight differences, but generally because of the drug standards, they should be generally very, very similar. Um, so this is a chart that just compares some of the drug names, the generic name versus the chemical name, which you can see is very, very long and you do not need to know. And then the trade name, which is the name the company is marketing it for. You'll notice that the generic names are lowercase and the trade names start with an uppercase. Now, a trade name with a number. So trade name of drugs sometimes include numbers like Tylenol number 2, Tylenol number 3, Tylenol number 4. Generally, the number refers to the amount of generic components which help differentiate it from almost an identical product. So the example below, which is for Tylenols, demonstrates the same amount of acetaminophen with varying amounts of a controlled substance. So Tylenol number 2, they all have acetaminophen 300 milligrams in them, but the number 2 stands for 15 milligrams of codeine, number 3 for 30 milligrams of codeine, and number 4 for 60 milligrams of codeine. Tall man lettering. So the purpose of tall man lettering is to take look-alike and sound-alike drugs, which can be the leading cause of error, and help differentiate them. So a distinct process is identified as tall man lettering, was created to ensure emphasis is placed on specific parts of the drug name to assist in the reduction of medication errors. So an example for that, Celebrex and Celexa are often two medications that allow for confusion. So to reduce error, Celexa would be written as CELE with a capital XA, and Celebrex would be written as CELE with capital BREX to emphasize, the emphasis is placed on the end to grab attention. So when you look at that, you'll be like, okay, that's Celexa and this is Celebrex, just to make sure that there's no confusion when looking at these drugs quickly. Legal accessibility of drugs. So drugs not only have a classification, a generic name, a trade name, a chemical name, official name, they also have names that imply the legality of accessibility. So some legal terms are often referred to as over-the-counter, or legend drugs, which is your prescription drugs, controlled substances, which are those that are monitored by the DEA, and then there's off-label medications. So over the counter, there's no purchasing restrictions by the FDA, with some exceptions such as pseudoephedrine, which is over the counter but is kept behind the pharmacy counter. And then there's legend drugs, which are prescription drugs. They're determined unsafe for over-the-counter purchase because of possible harmful side effects if taken indiscriminately, including birth control pills, antibiotics, cardiac drugs, and hormones. Recently, I have seen birth control pills available over the counter on the pharmacy counter. So that's something that is new and changed as of very recently. A legend drug requires a legend or a warning statement, like federal law prohibits dispensing without a prescription. And so that will be on each one of those drugs. Federal law prohibits dispensing without a prescription. So those are legend drugs. Controlled substance. So a drug controlled by a prescription requirement because of the danger of addiction or abuse. So those are those schedules 1 through 5. Those are controlled substances. They are considered highly addictive or cause for misuse. Then we have off-label medications. So these are drugs used in a way not intended for the FDA label. An example would be an antidepressant that's used to treat nerve pain. And so there are some SNRIs, which is a serotonin norepinephrine reuptake inhibitor that also helps with nerve pain, but it cannot be, should not be prescribed for that, and if it is, it's considered off-label use of the medication. Drug labels. So there is a figure on here that shows information obtained on a drug label, including the trade name, which is Percocet, the generic name of the two drugs, oxycodone and acetaminophen, and the controlled substance marketing. So it has that disclaimer on there. Drug reference guides. So it's imperative to become knowledgeable about drugs you'll dispense. You shouldn't be giving a drug unless you know what it is. There are many different drug guide references available. Selecting one most suitable for your practice is important. The three most utilized are the physician desk reference, the United States Pharmacopoeia, and American Health System Formulary Service information, which is available. They're all available online, and some of them are available in print. When researching drugs, a various drug reference will utilize similar format to describe drugs. So it's important to understand the specific headings, what is found within those headings, and used in reference tools to quickly obtain information. So different headings can include the drug indication, action, contraindication, caution, side effects, or interactions. So a quick self-assessment, just based on what we talked about. Can you differentiate between the terms trade, generic, chemical, and official as they relate to drug names? How does tall man lettering help reduce medication errors? And can you explain the terms used to describe drug actions that appear as headings under each drug in a drug reference source? And so that would be your actions, indications, side effects, cautions. So that's just a quick self-assessment check. And that is the end of this lecture. Thank you so much for listening.